Let's talk about physical activity and recovery after bariatric surgery. My name is John Pilcher. I'm a bariatric surgeon in San Antonio. What you're going to hear in this video is my understanding of the best way for patients to recover after surgery. And as a disclaimer that you'll hear again at the end of the video, I want you to discuss these ideas with your surgeon before you put these ideas to work. This topic of optimal recovery is understandably important for people who are thinking about bariatric surgery because they have very realistic concerns about when they can go back to work, when they can return to childcare or other normal activities. The traditional concept of physical recovery involved laying back or resting quite a bit to allow the body to conserve energy and to put that energy into the healing process after the surgical trauma. There was something to be said for that because there is energy required for healing, but the more modern concept of recovery shows that the more active a person is, the lower complications they have, actually the better energy they'll have, and better recovery overall. Thinking about the complications in particular, we're very interested in avoiding blood clots, and one of the best ways to avoid blood clots is to walk regularly as soon as you can after surgery. And we also want the lungs to function as well as they can after surgery. Anesthesia naturally reduces lung function a little bit in the first few hours after surgery is complete, and getting up and walking and sitting up in a chair helps the lungs recover much better. These are the main complications that are prevented and reduced by being up and active as quickly as possible after surgery. Furthermore, people actually have less pain the more active they are after surgery. A lot of the pain that you have in the day 2-7 after surgery is a stiffness of the abdominal wall. And the more motion that you have, the more movement that you do in a natural, gentle manner, allows that stiffness to break down and allows the abdominal wall to return to its natural, supple nature with less pain. Third, people have better intestinal recovery after surgery. That means less nausea and less rates of constipation. And last of all, there's this sense of better energy with more activity. There are several features of modern bariatric surgery that are making it easier all the time to get back into normal activity quickly after the surgery is complete. The change towards smaller incisions or minimally invasive surgery took place in the early 2000s and is very well established now. More recently, surgeons have been using a variety of medicines, mostly before surgery and then also during surgery, to cap the pain level or keep it at a lower threshold so that the pain never really takes off. In our own practice, we use a series of medicines in the preoperative holding area before the surgery and before anesthesia begins that reduces the need for pain medicines during the surgery and after surgery. We're also using a long-acting numbing medicine throughout the abdominal wall and especially in the areas of these small incisions that again will block the pain nerves and keep the pain to a low level. So in practical reality, people are having a bit of pain as they're coming out of anesthesia in the recovery room, but then after that it's usually more like a soreness, like 100 sit-ups or 200 sit-ups. So far I've been talking about how important it is to be mobile after bariatric surgery and how it's practical to do that. Now I want to break this down into some practical steps. I'm going to talk about how patients should move while they're in the hospital, the usual first couple of weeks of recovery at home, and then in the long run how physical activity is important for health and weight control. Regarding the hospital phase, we teach our patients and our nurses that it's important to be up and walking as soon as it's possible after surgery is complete. So usually what we do is within the first couple of hours when the patient arrives from the recovery room is we get them up walking at least a few steps to the bathroom. And then as soon as they can get out and walk in the hall and do laps in the hallway, the quicker their recovery overall. Once again, what we're aiming for here is to get the blood circulating in the legs to reduce that chance of blood clots, to get the air moving in the lungs to get the lungs back to their normal function, and to keep the pain low by keeping the abdominal muscles moving just a little bit in a natural flexibility. In my own practice, when patients go home from the hospital, they only have one restriction, and that is not to drive while they're on the opioid pain medicines. I hope that's obvious because this is like driving intoxicated. In fact, it is driving intoxicated. Now the good news is that with all of our measures of getting mobile early and blocking the pain level, people usually don't need pain medicine for too long, so most of my patients are able to drive a day or two after they go home from the hospital. In terms of other activity at home, I want my patients walking a lot. I want them out of the house, I want them to go shopping, I want them to be in control of their own activity, but with the understanding that more walking is good. It is okay to go up and down stairs, it is okay to shower. Actually, it's okay to shower starting on the day after surgery and to do light housework even the first couple days at home. Now I'm going to see people back at their first clinic visit 7 to 10 days after the operation is complete. We're going to check out the incisions, and as long as everything is healing okay, I'm going to allow patients to go forward in unrestricted physical activity. They'll still be a little bit sore at this stage, and so they're probably not ready to go and do jumping jacks or kickboxing or that kind of stuff. But if they felt like it, I definitely would be okay, because even at 7 days after surgery, the muscle wall has enough strength. Remember, little incisions, not a big gap in the muscle. The muscle wall has plenty of strength to handle normal physical activity, including lifting and core work and that kind of thing. Now, a concern often comes up, well, if I'm too active, am I going to hurt my sleeve, or am I going to hurt my gastric bypass? And that's a good question, but the answer is no. When we're talking about physical activity, moving around, doing sit-ups, doing exercises, that's affecting the muscles of the abdominal wall, but the intestinal organs are cushioned within the abdomen and they're not affected by physical activity. As a side note, you could hurt your sleeve or hurt your gastric bypass by trying to eat a big old cheeseburger, but I've really never seen patients do that, and that's obviously not related to the physical activity. So overall, increasing physical activity is absolutely safe, and it's a good thing to do. In our own practice, we like to use that post-operative appointment to get patients connected with our physical therapy team. Now, the physical therapy team is specialized to identify where a patient is in their physical ability. Do they have back pain? Do they have foot pain? Are they younger and still relatively healthy? Are they older and they've lost health? To look at these factors and design a physical activity program that's going to work for them, that they can actually turn into an activity program at home. Because we've learned that when people are given a program, they're much more successful implementing that at home, as long as it's fine-tuned to their own situation, than if we send people home and say, okay, go figure out your exercise program. So we're definitely going to structure something like that to help people get on track. So by the time a person comes back for their 1 month or their 2 month office visit, they should have a regular exercise program in place. As we move the discussion into the importance of exercise for long-term success after surgery, what we're talking about is keeping your metabolic rate up, and a lot of keeping the metabolic rate up is about muscle mass. Muscle is a type of tissue that needs calories to live, and so every extra kilo of muscle that you carry boosts your metabolic rate. And when we're talking about building muscle mass, we're talking about building these muscles that carry your body weight, the thighs, the buttocks, the core, and working these muscles and building these muscles, again, boosts your metabolic rate so that it's easier to keep your weight under control and not just depend on the dieting side of the equation for the weight control. Furthermore, as people age, they tend to lose a little bit of muscle mass, and the longer you can stay fit and have a good muscle mass carried into your 70s, 80s, and 90s, the more mobile you're being, that's the safer you will be, and the longer you'll live. The longer you'll live independently, which is really important to all of us. And so the current thinking is that the best type of exercise is the muscle strengthening exercise. But we're not against cardio, and so a nice happy medium is to do your muscle building in a relatively brisk pace, so you capture some cardio as well. We're not against cardio at all. I have some patients who are tremendously successful with long distance bicycling, with running, treadmill, and that kind of stuff. But on average, it seems like strength training with muscle building is the most effective exercise in the long run. In closing, I just want to go back to my disclaimer. What I've been talking about here is my opinion about the best way for patients to recover after bariatric surgery. It may or may not fit with your surgeon's ideas, and your surgeon's ideas are the most important for you. So please check it with your surgeon. Go forward in health.